Hi, my name is Chelsea Johansson, and we're going to be going over infection and immunity in a first-year nursing school class. There will be a didactic portion completed in the classroom where we'll go over some lecture points, and that will finish up with an overview quiz. Lastly, there'll be a lab portion where students will verbalize and properly demonstrate the donning and removal of protective gear to protect themselves from any infection processes in the hospital setting. We're going to start lecture by looking at a few of these images here on our slides. One photo focuses on a foot area, the other looking at a microscopic cell slide. Take a quick look at these, think about what you think might be going on. We're going to go over some facts that a patient presented in the previous photo has going on. This patient presented with an elevated temperature, a positive blood culture, an increased or elevated white blood cell count. The site that you saw had redness, swelling, it was painful for the patient, and had some drainage. My question for you all is, based on these images and the facts given, what do you think is going on with this patient? So based on the images, the facts, and the question asked, the patient presented with infection. This lecture is going to go over infection and immunity. The course objectives for this class are that by the end of this course, students will be able to recall the cellular level of infection, apply knowledge learned in this course about infection and the disease processes. They'll be able to identify different immunity types, including active and passive immunity. And lastly, students will be able to verbalize and demonstrate proper donning of protective equipment. Infection is an invasion of the body's natural healthy tissue by an outside organism. This organism is foreign, it invades the body and causes that healthy tissue to become infected or diseased tissue. So the immune system is the body's way of fighting off bacteria, viruses, fungi, and parasites that is exposed to the body. The immune system is made up of white blood cells, which is also known as leukocytes. These leukocytes work by invading the infected tissue with healthy cells, trying to get rid of that infected process. This process of the white blood cells going in and taking over the infected cells is a process known as phagocytosis, which we will go over a little bit later. The body then can form antibodies that inactivate the invading organism to stop the invading organism from multiplying any further. There are 6 types of leukocytes. A few mentioned here are granulocytes and monocytes, which protect the body from the invading organisms coming in the first place. And then there's lymphocytes, which work on the immune process. And those cells are what go out to fight off the infection when it enters the body. Neutrophils and macrophages are types of white blood cells. They're responsible for attacking and invading bacteria if an infection does occur. These cells move through the body towards the infected tissue, and this is a process known as chemotaxis. It is the movement of those cells towards the infected tissue, almost like a calling sign to come help invade the infected tissue with healthy cells. This is where phagocytosis takes place, and there's a cellular ingestion of the infectious agent. So phagocytosis is those healthy neutrophils and macrophages eating the infected tissue. Infection or inflammation can be internal or external, so it may not always be visible to the naked eye. But when inflammation happens, the infected tissue becomes inflamed, meaning the blood vessels widen, allowing an increased blood flow to that area. This makes the area red, swollen, and fluid-filled or puffy, which is what we're often used to when we talk about inflammation. The body's reaction to inflammation is it seals off that part of the body. It doesn't want the inflammation to continue to spread to other parts of the body. It slows down the toxic products from invading other healthy tissue. At that point, the macrophages and neutrophils that we were previously talking about invade that closed off, inflamed area and begin the process of phagocytosis. As we briefly mentioned earlier, the immune system kicks in. So what is the immunity doing? Immunity is the body's ability to resist almost all types of organisms and damage to the tissues. There's a few different types of immunity that we'll go over. Now, these topics are what your end of course quiz will be focused mainly on, so please make sure that you understand all of the different types of immunity and ask any clarifying questions. Acquired immunity is something that the body acquires from the outside to allow the body system to fight off an infection. This happens after the body has already been exposed. So let's say you get a cold. Well, you caught that cold because your body was unable to fight off that infection. But once you've been exposed to those organisms, your body is then able to build up antibodies that will later be able to fight off those organisms if they were to return. This is a production or a product. The acquired immunity is a product of the body's lymphocytes. Another type of immunity is innate immunity. Innate immunity is something that the body naturally does. For example, phagocytosis. This is what the body already knows how to do. It's going to do its best with what it has in its arsenal to fight off any infection that's coming in. So underneath acquired and innate immunity, really more focused on acquired immunity, there can be active or passive immunity. You may have been more comfortable with these terms. Active immunity is a person's body's ability to develop those antibodies from exposure. So they can develop antibodies or activated T cells. We'll go more into that in a future lecture, but activated T cells are a form of lymphocyte that the body creates when they're exposed to that pathogen or organism that came in from the outside. Those are the cells that are produced that remember, oh, that's a bad cell, we need to go fight that off. So this is in response to an antigen invasion. Prime example of active immunity is immunizations. So we give immunizations, which are inactivated disease processes, for example, the chickenpox vaccine or whooping cough. We're not actually giving our patients these disease processes because the diseases are inactivated inside the immunizations. But the immunization is allowing the body to start this process where they've been exposed to some form of that invading organism, so that if the body was exposed to it at a later time, it would know how to immediately produce those activated T cells or antibodies to fight off that infectious process. The other part of immunity is passive immunity. This is a temporary immunity. These immunities you can get when you have some form of transfusion, whether from another person or an animal product. It temporarily gives the antibodies from one person to another. So, for example, when a baby is born and they're breastfeeding, they acquire their mom's antibodies in that breast milk for a short amount of time until they're able to start to produce their own form of antibodies. So that is known as a passive or temporary antibody, so that those don't last forever. So that's a little bit of the lecture portion. Here's a couple of the references used for this lecture. So next we're going to go into this final quiz for this lecture portion, and then following the lecture portion, we're going to go in, or following the quiz, we're going to go into the lab setting. So in the lab setting, we're going to be going over personal protective equipment, also known as PPE. This is the CDC's recommendation for proper donning and removal of PPE. Like I briefly had been talking about, we want to make sure in the hospital setting when we're dealing with patients that have infectious processes going on, whether that be contact, airborne, any form of isolation that may be going on in the hospital setting, we want to make sure as healthcare providers that we're protecting ourselves from whatever is going on with the patient. Please go over this CDC handout, read it over, ask any questions, because I'm going to have you verbalize the process while you're doing it and the reasoning behind that while you're putting on and taking off this gear.